Hello and welcome back. If you're watching this video presentation, that means you've completed your workup and now you're ready to proceed with your weight loss surgery, vertical sleeve gastrectomy. During this procedure, a big part of the stomach will be removed and you will be left with a very small, narrow, long stomach pouch. This procedure will help you cut down the amount of food you eat and help you lose weight. This video presentation will go over a few important facts that you need to understand and remember before your operation. You will meet with me and we will go over the paperwork and any questions you might have. Let's start with preparation for surgery. In preparation for surgery, you will need to stop certain medications. Commonly, these are blood thinners like Coumadin or warfarin, Plavix, or aspirin. These medications need to be stopped for at least 5 days before surgery. Some other medications that need to be stopped include natural supplements or herbs. Some examples are ginkgo biloba, St. John's wort, even vitamin E, glucosamine, and fish oil. We recommend that these medications be stopped for 2 weeks before surgery. There is a list of medications that need to be stopped before surgery in your bariatric folder. And again, if you have any questions about medications, please ask those at the time of your consent visit. We recommend that you either bring an updated list of your medications with you at the time of consent visit or bring the bottles of those medications with you so we can check them ourselves. When you come to see me at the consent visit, we will be signing papers which are consent papers for surgery. Those papers will mention the risks and complications from this operation. Generally, the risk of complications is low, and these complications include but are not limited to bleeding that requires blood transfusion, leakage that can cause infection or sepsis that could prolong your hospitalization and need antibiotics for a longer duration than usual. Other complications include lung infections or pneumonia. The risk is higher among smokers or people who have history of previous lung problems. Blood clots that develop in the veins of the thighs and pelvis. The risk is higher in people who are not physically active. So we will have you get up and walk around every 4 hours after surgery, and we'll have you exercise your ankles, knees, and hips 10 to 15 times every hour. We recommend that you start doing that now so you develop a habit of doing that. There are other rare complications and the paperwork that will be given to you will mention those. Please take a good look at those papers and ask us any questions you might have. You will also meet with anesthesia team before surgery in our PACE clinic. They will go over the risks and complications of anesthesia. If you had any problems with anesthesia in the past, please make sure you mention that so they are aware. Before you come to see me for the consent visit, we would like you to watch this video presentation and sign on a piece of paper that you have watched it and have a family member witness it. You may have to repeat your chest X-ray and EKG if it has been more than 6 months, and you will need to do some blood work before surgery. You will be put on high calorie, low carbohydrate, full liquid diet before surgery. The goal is to shrink the size of liver that makes the operation easier and reduces the risk of complications. The duration of that diet will be determined when you meet with me, depending on your progress with weight loss so far. 1 to 2 weeks is usual. We recommend to use bariatric fusion protein shakes for that purpose. You will need to drink 4 shakes a day. You can mix them with water or with 1% milk. Bariatric fusion protein shakes are high in proteins, they are low in carbohydrates and high in fiber, and they have all the essential vitamins, and they are specially prepared for bariatric patients. If you are not able to afford those, then you could use Carnation Instant Breakfast, no sugar added version. In that case, you'll be drinking 6 of those shakes a day. Again, you can make them with water or with skim milk or 1% milk. During the liquid diet phase, it is extremely important that you drink a lot of fluids. We recommend to drink a lot of water or other diet liquids like Diet Snapple, sugar-free Kool-Aid, or any other flavored water. We recommend that you avoid fluids with calories. It is easy to get dehydrated when you are on liquid diet, so you should watch the color of urine. If it is dark or if your mouth is dry, you are not drinking enough fluids. You might also notice constipation. In that case, you can take an over-the-counter stool softener. And if that is not working, you can call our office and we can prescribe something stronger. You might feel dizzy or lightheaded, so it is important that you get up slowly from a sitting or lying position to reduce the risk of a fall or injury. The day of surgery, you will come to hospital empty stomach, so you should not eat or drink anything after you go to bed. You will be given instructions if there are any medications that you can take with a sip of water in the morning. You will come to first floor of the hospital, and then you will be sent to second floor where the operating room is. You will meet with a lot of staff members and they will ask you a lot of questions. Some of them will be repetitious, but please bear with us, they have to ask you those questions for documentation. You will once again meet with the anesthesia team. They will start an IV, and if you need a medication for anxiety, they'll give you that. The operation will take about 2 hours, and you will then spend an hour in recovery room. Your family will not see you for about 3 hours. When you wake up in recovery room, you might have some nausea and you might have some pain. You will be given pain medication and nausea medication. You might have a bladder catheter which will be taken out next day. You might have a drain that comes out of the abdominal wall and might stay for 1 or 2 days. Most likely you will not have a nasogastric tube. From the recovery room, most patients go to a regular floor which is on 6th level, is called 6 South. When you get to that floor, the nurses on that floor will have you get up and walk around every 4 hours. It is important that you try to walk more and more every time. They'll also have you do some breathing exercises to reduce the risk of lung infections. And as I mentioned earlier, we recommend that you exercise your ankles, knees and hips 10 to 15 times by bending them and opening them to reduce the risk of blood clots. Next day, you will undergo an X-ray test. They will give you a cup of medicine to drink and take pictures. If that test looks good, we'll start you on clear liquid diet. Some people have nausea after surgery, and sometimes that can be because of edema at the surgery site. And in that case, the X-ray test needs to be repeated on 2nd or 3rd day. We will give you plenty of nausea medication to control your nausea, and you will need to be in hospital till you are able to drink 5 to 6 glasses of liquids a day or within 24 hours, because otherwise you are at risk of developing dehydration. You will meet with another dietitian who will go over your post-op diet in details. We will give you a written copy of discharge instructions and medications that you need to take, and we'll also have you watch another video presentation that will go over those instructions in details. I hope this information is helpful in preparing you for your surgery, and please don't hesitate to ask us any questions at any time, and I will see you when you come in to sign papers, and then see you at the time of surgery. Good luck.